himself, "Jahan jago wahi savera." Your time has come, my dear Lalit. Savera has come. Dr. L M Parashar is an eminent ENT surgeon. He is my batchmate, as was Dr. Ranjan Wadhwa. He is at present director at Asian Institute of Medical Sciences, Faridabad. He is a renowned ENT surgeon practicing in Delhi and in NCR with a cumulative experience of more than 30 years. Dr. Parashar holds his expertise in treating and managing all ENT diseases, and his specialized areas of treatments include treatment related to all upper respiratory tract and the ear disorders, and also provides specialized medical and minimal invasive surgical care for functional disorders of the nose, paranasal sinuses. He is also into skull-based surgeries, into specialized nasal polyps, deviated nasal septums, allergies. Also his field includes surgical treatment of obstructive sleep apnea, and he is an esteemed member of many prestigious health institutes and medical bodies, having served as secretary of Association of Laryngologists of India, difficult word to pronounce, and much more. He strives to provide top quality and compassionate treatment to his patients every day. At present, Dr. Parashar is practicing in Apollo Spectra, Kailash Colony, as far as Delhi is concerned, and as I mentioned, is director of ENT at Asian Institute of Medical Sciences, Faridabad. He is also attached to PSRI Hospital for those of you who want to send cases to him in Delhi. More important than that, Dr. Parashar has been our soulmate for many of us, especially my soulmate during Maulana, and I thank him for taking me to Udupi 1 o'clock in the morning for eating parathas after we had our full-fledged dinner only at 10 o'clock in the night. Dr. L M Parashar, ladies and gentlemen, for you on Preventive.
Thank you very much. The reason why we are all gathered here is on the screen. We all love Modi ji, and we of course appreciate what he has been doing for our country, and we wish him all the good health, and he should be leading us for maybe many more years to come, so that we become the Vishwa Guru what we want. He has given a very good mission to us that by 2047 we should actually be called a developed country, and we all should be working and striving to attain that. I thank all my friends present in the auditorium, as well as of course many more who are likely to see this program on the internet and on live telecast, as I am told. So coming to the preventive ENT diseases as part of the World Holistic Health Day, I would take you through few things which over the period of time we have, I as a practicing ENT surgeon have come to know. So these are my Man Ki Baat instead of Modi's Man Ki Baat. I would like to give few messages which are basically preventive in nature. Please do not ignore sore throat and cold. I say it earnestly because sore throat and cold, quite common disease. All of us actually have about 2.5 episodes per year, sore throat and cold episodes, and 4 to 5 out of 1000 community episodes lead to complications, and these complications generally are tonsillar abscess, pneumonia, ear pus, and even sinusitis. So this is how acute infection in the throat looks like, infection in the ear pus. Similarly, it can lead to perforated eardrums. So thumb rule overall, if we can take one take-home message from here as a prevention, is that please do not ignore yourself. If there is anything abnormal happening in the body, any part of the body, not only my ENT field, any part of the body, don't ignore it beyond 48 hours. If something is lingering on for more than 2 days, please contact your nearest doctor, any doctor you have your access to, any doctor in your area, locality, in your street, in your mohalla. If your doctor is not able to handle the case properly or leave you within 2 weeks, 2 weeks is the next big thing. If within 2 weeks the relevant person is not able to give you the proper medical advice and your symptoms persist beyond 2 weeks, please go to the relevant specialist. Go to the relevant specialist, because the specialist will be having, specialist doesn't have a magic wand. Why should we go to a specialist? Because the specialist has, like in my ENT, all the good ENT centers will have ENT center of excellence where they are able to look inside the body, they are able to make whatever is wrong in the body, and therefore we come to a better conclusion. We can look at the eardrums, we can look in the nose and find out more. Why is it not moving? Well, good thing about these things is that they work very well when we are so I am showing inside. This is how we look in the, well, it is working here, not working here. How do I manage it, man? Any technical help?
Sir, click on that, click on the video.
I have done all. Nothing seems to be working.
देखो भी जरा
ऐसा भी है क्या?
We are wanting to look inside the nose, that is the nose, you can see the hair. Everything works very well in preview, but sometimes during the conference, of course, they give way. The basic idea what I was trying to convey was that the specialist knows how to deal with these things. Specialist has more experience about dealing with such things because of the better equipments available. So we run through and reach the same, and it doesn't work this time also. We can look inside, see the tonsils. We can similarly go and look inside the nose, and we can find out there are adenoids at the back of the nose. Similarly, we can look in the throat and come to the conclusion that there is a growth of the vocal cords. So these are the ways the specialist is able to look better at his own field things, like the vocal cords. So a properly managed patient will be able to avoid the complications. So therefore it is imperative that we are with the relevant specialist of that particular area where you are having the ailment in the body. Few other messages are about not doing things which we normally want to do because we want to be clean. The first and foremost of them is the cleaning of the tongue. Well friends, cleaning of the tongue is actually not required, contrary to whatever else you may feel. As we say, rolling stones do not gather any moss. Our tongue is a moving object, it keeps moving, and eventually our tongue is just the first 10 centimeter of our alimentary tract. So what will be achieved by cleaning just 10 centimeter and leaving the 60 feet of the intestine not clean? So idea is we should not be cleaning. In the process of cleaning, we injure our tongue, we injure our taste buds, and therefore we end up in problem of tastelessness. A similar thing is cleaning the nose. People land up in big troubles in trying to clean the nose, especially there is a fashionable to keep long nails nowadays, and I wonder how the young girls and ladies who keep long nails are able to look after themselves. But please don't clean inside the nose. We have tissue paper, Kleenex or water simply to clean the nose. Maybe a hanky will do, but please don't go enter the nose to clean it. It leads to bleeding and sometimes lead to very bad consequences, especially if the person is taking any blood thinners. Similarly, the ear. I don't know how this notion has come up to everyone that कान साफ करना पड़ा, ये कान की मैल साफ करनी है. If I tell my patient please don't clean your ear, they say oh कैसे करेंगे, बर्ड नहीं मारेंगे तो. So simple fact is nature is looking after us. Nature has given us a gluey substance. First of all, we have to realize that this is not a mal. This is simply some bodily secretion, like we have tears, like we have nasal secretions, like we have saliva. Tear is not bad. It is not bad thing that we have to go after it and clean it. It is just that it will be formed there. It will be there to protect inside thing which is the eardrum, and therefore we should not go hammer and tong to clean it. All we are required to do is move our jaw, which we anyway do while eating, while talking, and the wax tends to flow out. All we are required to do is to use our any finger, clean the ear, and that's all. Nothing. Nature does not require us anything more than this to clean the ear. Beyond this, please consult your ENT doctor or even a local doctor with the torch can think of knowing what is inside now. So no buds please. There is no word in the English dictionary called earbuds. They are buds erroneously used in the ear. Before 100 years from today there were no buds, no earbuds. So please don't use buds, don't have in the home, don't purchase buds in the first place. Every week I get 10 to 12 bud injury patients who are equally intelligent and want to clean कि हम तो बाहर ही थे पर अंदर पता नहीं कैसे लग गया. So it happens. Similarly, any other object people sometimes absent-mindedly, sometimes knowingly and consciously put things inside in an effort to clean. They can't see the ear canal is quite tortuous, so they injure the canal or the eardrum, and results are sometimes very very bad. Like you can see see over here. This is the perforation in the eardrum, and if it gets infected, it can have bad consequences like a rounded eardrum perforation requiring ear surgery later on. We have been flying a lot nowadays. Almost everyone has a few flights to catch almost every month. So we have to be careful. If we have any cold or sore throat, we should not be flying. We can delay our departure. We can maybe take medicine before that. Maybe we can take the things to even clean up the nose. I would go ahead to say that even things like Otrivin and Nazivion can be used in the nose so that nose is perfectly open and functioning properly before we take the flight. Otherwise you please cancel the flight, otherwise the consequences are very very bad. Our ear can have barotrauma, a change of pressure from the ground to the air and then coming back. This can lead to injuries inside the middle ear, and that is a very dangerous thing. It has to be properly managed if it occurs, and please consult an ENT specialist in this particular scenario definitely. Similar is that any child or adult having ear pain, immediately following 1 or 2 weeks later, some pain in the ear. So anytime you have ear pain and if you have had a cold or sore throat within last 2 weeks, please go and check your eardrum, because there can be infection in the ear and that can lead to the consequences that as we showed earlier. There can be a perforated eardrum and there can be consequences like microear surgery required later on. Another thing which is quite ignored is hoarseness. People keep on talking in a very hoarse voice and they think it will go away, Please don't ignore. Don't ignore beyond 2 weeks, because any hoarseness which persists more than 48 hours can actually be bad, but occasional laryngitis bout can last maybe up to 2 weeks, but anything which is more than 2 weeks, it should be arouse our suspicion. We should actually go after it, check our vocal cords. There are methods available nowadays. A friendly ENT surgeon is available round the corner anywhere. So please find out. We can see the vocal cords and know whether everything is alright or things are actually bad. Like you can see the growth over there on the vocal cords, or there can be even bad growth which can actually be cancers. So we should detect them early so that we are able to treat them early, like plucking it off and getting a biopsy for it. Similarly, we have a lot of problems in the India, especially in the oral cavity. And oral cavity is such an easily accessible part of our body. So why don't we look inside? One, our bathrooms are maybe not very well lit, so please have very good lighting system available in the bathroom setting so that you are able to look inside your mouth. And please open the oyster to have a look inside. Anything with like ulcer, white patches, pigmentation, growth should arouse our suspicion. And if something is bad, either go to the friendly dentist in the area who can have a look inside, or go to the ENT specialist in the area, or your general doctor can see and maybe refer you to the proper specialist if required. The oral cancer especially is a major problem in India because of our food habits, because of our chilies, because of tobacco, because of our gutka especially, which is peculiar to India only. And we have almost 30% of our all cancers which are oral cancers. And if we take the aerodigestive tract as a whole, 40%, it accounts for 40% of the total cancers in India. So it is imperative that we look after our oral hygiene and we look into the oral cavity properly and almost on daily basis. Don't ignore any of these things like ulcer, patches, and I am just showing for your record that this is how they look in the first place, and even the furred tongue or cut tongue. Similar thing is headache. Somehow there are two diagnoses in India which patient does not bother to go once the label is there. One is migraine, any kind of headache, and some doctor labels it as migraine. patient is very happy with the diagnosis, can live 30 years from there on. There is a migraine है, कोई कुछ नहीं है इसका इलाज. Second is the cervical and vertigo. जब cervical हो गया, vertigo हो गया, कोई इलाज की जरूरत नहीं है. Now somehow these two diagnoses are just the wrong labels. We should go check properly and find out what is the exact reason. And therefore I request all of you not to ignore headaches. Any headache should not be labeled as migraine. We can go inside, look inside properly. Like this 27-year-old man was living with a so-called migraine for last 24 years, last 20 years. And you see, this is what we found, that there was a polyp inside which might have been since childhood. And similarly, presently we have so many good radiological assessment tools available to us. CT scan will simply clear up the issue in a minute, and we'll know that there are polyps inside, there are infections inside the sinuses, and we can easily take out, if I may point out, that this is a normal sinus and this is a abnormal sinus. So we can very clearly find out what is the problem, and once we know, we can always go take the patient to the OT, clear up the things, keep doing the endoscopic sinus surgery, and let's not go into the steps. So one of my last messages is that we should not ignore snoring. Any person with my kind of physique and who is snoring generally gets laughed off in the family settings, and people make fun of it, but it can actually be very, very serious also. So since most of us are medical people over here, so I may say just apply 3-step guideline what is wrong there. So find out the clinical symptoms of daytime sleepiness, nocturia, that the person has to get up in the middle of the night, and thirdly dry throat when the patient gets up. If these three are there, please subject the patient to sleep study and dynamic MRI. Know whether the patient is having actually obstructive sleep apnea. It may not just be plain and simple snoring. And if there is one, we can go with dynamic MRI, find out what is the cause of obstruction, seat of obstruction. Generally it is the nose or palate or tonsil, or maybe somewhat down there, the base of tongue, and we can easily control these things. These surgeries are available in India, in your friendly neighborhood. Like this 30-year-old man had a miserable life, almost on the verge of divorce, and you can see very thick uvula hanging and tonsils almost blocking. There is so much of crowding at the back of the nose, but even the nose is no more clear. As you can see, septal deviation, up there also septum is deviated, and if I go back and come out to the other side, we see this, there is hardly any passage for me to go in. So this is what you find in the OPD, and this is what you can actually measure and take out the tonsils. So let's not go there. Those things can be managed. Another thing, my fervent appeal is, please don't ignore the hearing disability. Out of all the disabilities we mankind have, the hearing disability is not visible to the naked eye. So people get very impatient driving on the road, honking, whether not knowing whether the other person actually is able to hear it or not. And this is one thing which is very well neglected at families. At the old people get neglected. The children who are born with such congenital malformation and deformities of hearing disability, they get neglected. So please be on the lookout. There is a universal screening program in the neonatal birth now, and we screen for a hearing test mandatorily and know the childhood hearing deficit. And if there is one, we can always try and settle it either with the hearing aids or with the cochlear implants. So just a word about cochlear implant, that we can implant part of the device inside the ear. This one can be implanted inside and this can be worn outside, and this magnet can talk to this magnet and get the symptoms, get the signals into the brain, and person who is not able to hear either two can again start hearing. And this brings smiles on the faces of parents and everyone once you have it. And of course in the end I thank Modi ji for a vision of having 2047 being the developed nation in India, and of course I salute the vision of our Sushil to take this day as a word of
for a very good talk and some very important carry home points for us. Just some questions for general knowledge. How many episodes of cold are normal for an adult in a year?
Sir, thumb rule is that not every big tonsil needs to be taken out, not every deviated septum needs to be operated upon. The thumb rule simply being that we all have on average 2 to 2.5 episodes per person per year. Okay. Some people or some group of people can be more susceptible to infections in the throat and cold. This can be children, especially children who have gone to school recently, they have joined school recently, so they can have up to 5 episodes per year. So up to that we should take normal. But any person who walks in, and if you take the not only the present episode history but overall yearly episode history, will come out that I am spending either having more than 5 episodes per year. That means we should investigate for the cause, either the throat or the nose, or person is spending more than 5 weeks of his life, like there are only 1 or 2 episodes but they last month long. So simple idea is that cold and sore throat should be lasting 5 to 7 days. 2 episodes means 2 weeks of his life every year go to cold and sore throat. That is normal. If this figure goes to more than 5 weeks per year, then needs critical examination, and we should move heaven and earth to find out what is the reason and treat that reason.
From your talk, what I understood was that it's not only about absolute prevention, it is also early intervention, which is a sort of prevention.
That's right.
So, is there any special precaution that we have to take in comorbidities like diabetes? If somebody has sore throat and he starts developing ear pain, so we have to intervene very early probably in this class of people.
Yes, in fact, diabetes is generally treated by my physician colleagues, and they are alert to the extra infection chances. So they immediately sense something going wrong, and they intervene more. Moreover, there is neuropathy also associated. So those patients may not actually have pain. Like in diabetic foot, pain is missing, and therefore they will end up with a lot of complications. The same thing is true in the tonsil area, nose, sinus, ear. All these can land up in bigger complications if there is polyneuropathy associated with diabetes. So one should be more alert. Is very right.
I want to ask a question.
Sure, ma'am.
Yeah, sure.
No, that's is there a routine for infant and toddler hearing aids, and should it be included like something like an immunization schedule? So because mild hearing losses will not be detected, so shouldn't it be?
Sir, ma'am, presently we have a universal
Or autistic children.
autistic. Okay, that is another chapter altogether. But there is universal hearing screening at birth. So they are doing.
But that happens because the patient is in the hospital, right? The baby is in the. But shouldn't you have a schedule, say 1 year, and if the speech delay is there, then 2 years, 24 months to 36 months, and how would you detect an autistic child then?
Okay. The whole chapter talk can be given on this particular thing. But simple thing is that yes, preventive hearing screening or the neonatal hearing screening is one tool, where we are not doing it immediately at birth. We are doing it generally, calling them at 2 to 3 weeks of age. When they come, we say whether it's pass or not pass. Okay. The person whose pass is okay, that child seems to be hearing, and there is proper otoacoustic emissions, and therefore child should be okay. Any child who does not pass, we call it refer. So from 2 to 3 weeks, we have suspicion that this child may not be hearing properly. We repeat the same test for after further 3 weeks of child development, and then at the 6 weeks again we see. If this time also there is again a refer, that means twice the child has failed the test of giving a positive thing, then we go in for what we call either ASSR or Pehla, that is brainstem lobe response audiometry, so that we know whether proper wave formation is there in the pathway to the brain, to the nerves or not, and if yes, then we think of early intervention by getting ASSR is getting the thresholds of the hearing loss again by the brainstem audiometry. So we get the thresholds. After having got the threshold, we can know whether hearing aid is required or not. Again, mild, moderate or severe. So in mild we may not give those, but in moderate to severe we should give the hearing aids properly and give at least for 6 months, so that child's speech development doesn't fall back. Because child who starts hearing at day 0 tends to speak only at 9 months of age or 6 months of age or 10 months of age. If the child is not hearing in the intervening, those functions will be taken over by the other areas in the brain. So this is how we keep on escalating the total our cascade. As far as autism is concerned, yes, in Indian settings, generally children with autistic disorders are not diagnosed properly. Parents are dismissive about even talk of such a bad thing. Sometimes the parents are in absolute denial when the other people in the family, other friends in the family can see. But the moment they broach the subject to the parents parents so much of denial that they won't even talk to them anymore. So these are all the challenges which occur. But eventually once you are diagnosed, there are proper ways in which not only the ENT intervention or hearing aid intervention is required, there can be total comprehensive child development intervention is required, so that autistic child is able to reach a peak of his or her prowesses to the best of human ability, rather than just be leaving at the wayside.
And you said 2 to 3 weeks and then 6 weeks. Then is it screened by the pediatrician? Because the first contact will be the pediatrician, isn't it?
Yes, now all the pediatricians, you ask anyone, they are sending the children for these screenings, and these are almost mandatory part of any hospital delivery. They are given the proper dates that you after 3 weeks will come. On that particular day, not only your pediatrician will have a look and have the weight and other things of the child looked at, but also the autoacoustic emissions will be seen, and any suspicion should be documented and looked after in time to come.
And in children which with speech delays, monosyllabic words or two.
Well, there are so many variations in that.
So how will so they will come with speech delays, right? If they have loss of hearing. So what is the percentage of loss of hearing causing speech delays? I mean, hearing problems linked with speech delays.
Almost 90%.
90%.
Only thing is there is so much variations of when the child starts speaking.
What do you call it?
Some are very smart, start speaking at 6 months to 7 months of age. Some are quite delayed, start up to 18 months of age. So there are so many variations. No two human beings are the same. So
is there an upper limit?
I am coming to that. So variations are there. So we say 18 months. By 18 months, child should be able to verbalize. And verbalization means speaking, but at the same time, hearing vocabulary also one can be tested, like child is able to point at the fan or water or food or mother or father. So child starts to differentiate between environmental sound and the spoken word. So you know the difference. So you know the child has got vocabulary. An 18 month child generally has about 1500 word of vocabulary by repeatedly getting exposed to these things. And therefore one can test the vocabulary. Whether child is able to speak those words or not is a different thing. Then again, nowadays most of the interventions are at the age of 2.5 to 3 years, when parents have to take the child for the school interviews, and that is the time when they get panicky. Sometimes it is unnecessary fears. Child is anyway okay within range, but some patients are actually delayed speech. So at these times, once they are detected, there are proper ways. It is not only ENT, it is a pediatrician and the audiologist, speech therapist. We all have to work together, and if in the process we also find out that there are other neurological deficits and there is autism or dyslexia or other things accompany it, then we have to involve the whole gamut of child development people, so that it is a comprehensive child development rather than just we are focusing on after speech only.
So in a lean elderly patient with OSA,
G.
so CPAP or a bypass?
Sir, surgery? I am a ENT surgeon. Simple things are, sir. Yes, once we do the sleep study, we know the severity of the illness. Our first and foremost aim should be to find out where is the level of obstruction. As I said, the 4 places: the nose, septum, palate, pharyngeal walls, tonsils, and the base tongue. These are the places where there can be obstruction. So there are well-known norms now. We can do the CBCT, which is conical beam CT scans. In that you can know the volumes. So if there is adenoid enlargement, if there is tonsillar enlargement, if there is something blocking the way, you can know the volumes and know the percentage of passage available to you for breathing. And not only in sitting but lying down, and similarly dynamic MRI can give you much more information about palatal thickness, lateral pharyngeal wall collapse. So with these things you can know more. I hope I could have shown you the footage of dynamic MRI. It is something like MRI vision, the dynamic film. You can actually see the person taking breathing. Each time it collapses and opens up, collapses and opens up. So you know where exactly is the problem. Once you know, there are 2 ways of opening it up. Either I can stiffen the walls or cut out and make passages. This is a surgical intervention. Then comes the other intervention. You say that you force open the passage by the force of air only, which is BiPAP and CPAP and automatic PAPs. So that is the idea. that if it is treatable, please treat it. Like in a child, simply removing adenoids and tonsil will be able to control the obstructive sleep apnea. Whereas in adults, despite doing everything, and there is a limit to how much palate we can cut out. So if we have done everything possible and still not able to relieve the thing, then we think in terms of putting the patient on BiPAP or CPAP. That of course, presently nowadays we are going in automatic PAP, so that automatically it knows what the pressure and how to obviate it. I hope I am clear.
Sir.
जी मालिक, वेलकम काला साहब.
तो मैं आया हूँ और आपसे सवाल ना पूछूं तो हाजिरी नहीं लगेगी. हालांकि इतने सारे सवाल पूछ लिए कि मुझे मेरा सवाल इतना छोटा सा लग रहा है. Question mule. I used to say half question, but it is even lesser than that. Sir, at times I see very poor patient in charitable also. Viral upper respiratory tract infection is most common, and majority of the people either they start themselves or some practitioners start antibiotic with them, which I think is wrong. But at times they need it also. What is your take-home message when we decide that this patient, even before getting a blood test, CBC and all that, to decide whether bacterial infection is also associated, it may be superadded. So what I feel my practice is, if the color of the expectorant is yellow, green, I think it is wise to start antibiotic. And if the fever is higher than what is usual, lighter fever and the higher fever.
My treatment agenda will be,
Yeah.
1, don't start antibiotic within 48 hours of the start of symptom, because infection, if at all, comes secondary bacterial infection. Generally it is viral infection initially, and as of now we are not giving antivirals for viral infection also. We are just giving symptomatic treatment, and paracetamol is the best treatment eventually. Other things can be added like decongestant for the nose or demulcents for the throat. Second point is, as you rightly pointed out, if there is any production of phlegm or secretions which are colored grey, green, whatever. So these secretions should alert us to the possibility of bacterial infection having set in now. That is generally after 48 hours, maybe 72 hours. If the nose is showing such secretions, throat is showing such secretions. Third and most important feature is pain. Pain occurs when the lymph nodes have infection. Generally bacterial infection tends to go to the surrounding lymph nodes in the area, and neck has got 200 lymph nodes out of total 800 lymph nodes away. Or once we know that in particular area, a particular epidemic is going on, we can know the choice of antibiotic. Generally starting with amoxiclav or microlides or whatever your choice is.
Thank you, sir.
Sir.
I think it was a very exhaustive question answer session on a very important talk by Dr. Parashar, and he has done full justice to the talk and to the question answers. As a gesture of gratitude, Dr. Sushil, as a